Who?
It's okay because
What funeral? Oh, really? They found Obama on vacation on the island? I thought he was jet skiing and stuff. Life.
Taking time off vacation.
From life. You ready? All right, we'll go. We'll go. He wouldn't be invited to Mar-a-Lago. I'd like to call the Human Services Committee meeting to order. Mr. Vaughn is on the phone, but he couldn't be here, so start out with the courtesy of the floor. Anybody like to address the committee? Seeing none, we're going to the first order of business, update on Graysdale. You're on.
short meeting tonight. Oh, yes, the book. Yes. Okay. I think I got these already. Thicker one. Yes.
See, as long as she has one, she'll send it to everybody. Thank you.
As requested, if you look behind the dashboard, you will see the 2016 dashboard. So we can compare that to the 2017 dashboard, excuse me.
Nice.
I want to pay particular attention if you look at our census for March of 2016 versus March 2017. You'll see there's not much of a difference in that. We're right on track. I could tell you also that since mid-March, we have been at or above budget of 660. We've been as high as 676. And currently, we're at 664, but we have 7 admissions coming in today.
Cool.
So we're doing pretty well.
Very nice.
Do you want me to do the comparison of 16 to 17, or just go over?
I don't believe you have to. I think you
Okay.
can just go over what we have, and if we want to do a self-comparison, we have plenty of time, but I like Reader's Digest versions of things and reports for committee meetings, unless
Okay.
we need to do a deep dive,
Yeah.
as my colleagues say, into parts of it that are
I hate that
concerning.
term.
Okay.
Dive.
All right.
Dive.
Next issue, besides admissions and what we have here and the numbers, they're pretty much consistent. The only thing is that our Medicaid has gone up a little bit in our ADC, which is our average daily census, just a little bit, to 12.9 from 7.8. And our bed hold days for Medicaid has gone up 83 days from February to 127. That's about it in admissions. With regards to you should also look at, in admissions, the referral rate conversion percentage. You could see that we're at 55%, which is best we've been. We've taken 55% of the referrals. Generally, we're at 34, maybe 42%, so 55 is really good. Finance, cost per resident day is a little bit lower because of the increased number of residents that we do have, and because it spreads out. And other issues of other information, of course, Peter has to still get in, including Medicare reimbursement. I'd like to go down to nursing, if that's okay.
Okay.
With nursing, you'll see that our LPN agency has dropped from 90,422 to 48,864. Course is cut in half, practically since last month. However, our overtime has increased, and that's for 3 reasons. Overtime has increased because we had 3 pay periods in 2017. We also had the snow emergency during that time, and of course our one-to-ones. But I am proud to present that our one-to-ones, that we do not have one 24/7 one-to-one. Everything has been broken down. Some are 1 shift, maybe 2 shift max, but nothing is a full 24/7. And we keep progressing with that. Okay. If there's no other questions for nursing, yes.
Just refresh me. So, like, the overtime for LPNs, it doubled.
Yes.
So, and you're saying that's because of the extra pay period?
Yeah. I did speak with finance about that, and they said it was an extra pay period. The only time you have another extra pay period is in September. So you have 3 pay periods instead of 2. So that would be why you have the increase. Okay, any other questions for nursing before I move on?
No, go ahead.
Okay. In terms of compliance risks, we had 2 anonymous complaint visits, one on the 9th and one on the 30th. The one on the 9th was unsubstantiated. The one on the 30th was substantiated. We did put in a plan of correction, and it was accepted by the state. So that would explain what we have there. Any other questions for compliance risk before I move on to quality measures?
No, seeing none. Go ahead.
Okay. Quality measures, we were slightly higher than benchmark with pain, long-term, and antipsychotics. And of course, we're continuing to work on them through our designated committees. After I'm done with the dashboard, you'll see a pain committee synopsis. You had asked for that last month, giving you a total breakdown of what we do for residents who have pain and the type of tool that we use. So we could talk about that right after I'm done, if that's okay. Any other questions on quality measures?
No, go ahead.
Okay. Satisfaction survey, we're at the highest we've ever been. Average score is 3. We were at 4.31. I've never seen it that high since I've been here last August, so we're really doing well with that. And that is our satisfaction survey for residents and families anonymous. And out of the 37, we got back 16. So we did pretty well on that percentage. Okay. If no other questions with satisfaction survey, I'll move on to human resources nursing. RN turnover was 0% this month. LPN turnover was 1.6. CNA turnover rate decreased about 0.6, so it's very minimal. And in terms of our sick call-outs, they have decreased from 214 to 187 from February to March. Okay. And with regards to our star rating, we are at a 2 overall, 3 regulatory compliance, 3 staffing, and 1 on quality measures. And if there's no other question, I'd like to go on to the articles that I've given you guys, if that's all right.
Please.
Okay, sure.
You have a question? Hey,
Yes.
Yeah, I was going to ask, could we get this at least the day before?
Oh, sure.
Yeah.
Yeah.
You could send it to Linda.
Okay, no problem. I'll definitely do that.
And I
for
don't
you
even
guys.
necessarily have to get it in hard copy. If I
I'll
have
give you
it.
both 16 and 17.
go ahead, Seth.
There's a lot of paper being ruffled around the speaker. It's hard for me to hear. That's all.
Well, that's Mr. Kuzik's fault. He's sitting there flipping pages, so we'll make him mind his manners.
John, don't read the paper.
Yeah, come on.
He's reading the Times.
He's doing that Rush Limbaugh thing.
So you'll send that to Linda before the meeting.
Yes, we'll do that. No problem. Okay, I wanted to talk to you about the pain committee process. If you look inside, put that there, you'll see the Graysdale Pain Committee process. This is an overall synopsis, and we've really cut it down because we know that, to read a continuous amount is a little much for everyone. But the thing that you really should know is everything in bold. We do have our committee that we have, and we use the minimum data set to determine, physical functioning, mental status, general well-being. It should know that our nursing home compare information is 9 to 21 months old and can give you a skewed picture of the facility's care. When we get the report from CMS, it is a huge gap of time, and there's no way to narrow that down to just the month. So you're considering all the people from the year before in addition to the current year. And it sounds a little strange, but that's how they compile their data. So it's not really 100%, it's kind of skewed, but that's what we have to go by. So we're always basically including data from almost a year back when we give it. So just to keep that in mind with the quality measures. Also, we do have on Section P, which is our pain, we do have the assessments that are done by the Registered Nurse Assessment Coordinator, and they will ask them the question, do you have you had pain or hurting any time in the last 5 days? How much time have you experienced pain? Almost constantly, frequently, occasionally, or rarely, and rate your pain on a scale of 1 to 10. And what's important to note is this item is going to trigger on the quality measures report only from an interview with the resident. The staff assessment is excluded. A look-back period is 5 days. It will trigger if almost constant or frequent pain or at least one episode of moderate to severe pain was within that 5-day look-back. So if you just told me once, I have pain, we're going to trigger on pain. The other thing is, if a resident reports very severely or horrible pain of any frequency in a 5-day look-back, that will also trigger it as well. So it's very, very broad. And, you know, it does suggest root cause analysis that without specific definitions, it contributed to elevated levels of self-reported pain. And the pain committee will look, you know, at the residents who triggered for pain. The committee includes nursing administration, frontline staff, rehab, therapy, nurse practitioner, and our pharmacy consultant. And the team provides suggestions for interventions as indicated. And it's also addressed, pain will be addressed in the Falls Committee, the Psychotropic Medication Committee, and also the Behavior Team Committee. And we actually have a new pain tool that we're trying on one of our units, and hopefully we'll be expanding it to the rest, which really give a more accurate definition of when a person does have pain. You could see it on the next page. It's very detailed, specific to when they have it, the intensity, the frequency, and it even shows the actual body where you can list where the pain is. And then on the page after that, we have a pain scale for people with dementia, because a lot of them can't tell us. You know, if you tell 1 to 10, they don't know what you're talking about. You pretty much have to go with facial expressions, grimacing, that type of thing, to get a better idea. So you can take a look at this in detail, and I can answer any questions you have, you know, at a later time, because I know it's a lot of information, unless you have questions now.
Well, I have a question. So,
Yeah.
The term pain committee, how I understand, I'd be lying if I told you I understood this, but I have the high-level concept of this. Then how does the pain committee work in regards to this information?
Yeah, the committee will get together to determine when a person indicates that they have pain. They try to gather more information on the residents so they can determine the frequency and how often it is, so they can accurately put it on the MDS. Because you can have the interview with them and they can say, I have pain, but then we have to investigate, well, why is there pain? And there's actually an example in here where they said that, here is it. It said that they had asked a CNA about, you know, why this individual had pain, since they worked directly with them. And they said, you know, I think we need to change the chair that they're in, the wheelchair. And once they did, this person didn't have as much pain. So it's investigating every aspect of what could be causing the pain, you know, getting down to the root cause analysis of it.
And did you mention who's on the committee?
Yes. The people on the committee is nursing administration, frontline staff, rehabilitative therapy, the nurse practitioner, and the pharmacy consultant.
The pharmacy consultant.
Yeah.
Okay.
Because of the medication aspect.
Got to
And-
manage
and-
the pain.
Well, the question I have, though, is what is the input from, does this person have the ability to increase medications, or say that they need more, or put more in the machine on the floor that they need? How does that work?
Well, the pharmacist will, you know, give their input, but it's up to the team to make the determination.
Okay, so that alone doesn't...
Yeah, it's not just one
Okay.
person.
All right.
They can, yeah,
So
they
it's
make-
not the committee, it's the doctors.
right.
Okay.
Yeah, the team will go ahead and give their recommendations to the primary doctor, and they can determine if they want to give
Well,
them an order.
wouldn't the pharmacist also be there just for conflicting medicines to make sure that nothing they're on conflicts with what somebody's trying to prescribe and things like that, too?
Correct.
I mean, that would be mostly their function, right?
Right.
So-
And they
Yeah.
can,
Seth?
How often does the pain committee meet?
they meet weekly.
And are family members a part of the equation?
At this point, no, because the concern is that families could be a little more subjective. They might say, oh, they're in pain, and, you know, they're looking at it from an emotional
Right, sure,
point of
sure.
view as opposed to an objective point of view. It's hard for them to, you know,
Yeah.
to-
So, how do you assimilate all this information at the end of a week? I mean, this is a lot, there's a lot of information here that gets filled out. By
Yeah.
how many people fill this out?
Oh, well, we have, the one who primarily fills out the information is our quality assessment performance improvement nurse.
Okay.
She gathers all of the information from the paying committee and then reports on it monthly at our monthly QAPI meeting.
Okay. Wow.
So there's a lot of
So
information.
that monthly meeting is not necessarily to determine what's best for that individual patient, but to look at your overall management. It's
Right.
sort of like, quality control is how it's affecting that individual patient, and then quality assurance is that monthly in regards to our overall management of pain, a quality process. If
Correct.
I understand it right, yeah.
Yes.
Anything else for pain management and all this stuff, or can we move along?
Okay. Another article I have here, this is just giving you a little history in terms of what's going on with the, the deficiency process as related to the State Department of Health. We did have an Auditor General back in 2016 who did a complete investigation on the Department of Health in Pennsylvania, and they saw several areas that they felt they were not addressing. One was nursing staffing levels. They felt that they didn't have policies to address the minimum 2.7 of staffing. There was also complaint handling, apparently from 2012 under the Corbett administration. They did not accept anonymous complaints, and that's in direct violation of CMS of providing those anonymous complaints. And then last but not least, they were not, in terms of sanctioning nursing homes, they were not citing nursing homes for fines as much as the rest of the country was. And they felt that the nursing homes needed retraining, but then they didn't show that they did more than 30 in-service trainings for all of the nursing homes. So because of that, an investigation was done, and that's what led to the Department of Health saying, okay, we need to fix this. And that's why you see what you're seeing now in terms of deficiencies and things, because they have to really look at each home and
You mean
make sure that they're following the letter of the law.
They have to start doing their job.
Okay.
What's 2.7? 2.7 nurses per person, per resident?
2.7 hours per resident per day.
day.
Yes.
And how do you achieve that with 600 residents? That's
You
a-
don't. That's why we're at 3.2. It's impossible to achieve 2.7. It's the minimum, and we wouldn't be able to function at 2.7.
Right.
Most nursing homes can't. And they're thinking about increasing it, but we've yet to see what they're going to be doing about that. And any other questions about the article? Please take a look at it, and any questions, let me know.
Yeah, and like Hayden said, it would be nice to get these a day ahead so we can look at them. And
Oh, yeah,
'cause,
I'll do that.
I know Hayden loves to read these things, and he comes up with some pretty good questions with them. So
Yeah, no, I'll do that. That'll make everybody's life a lot easier. Other thing I wanted to show you is the bar graph. Just to let you know, in terms of quality measures, Premier actually looked at all of the county homes in Pennsylvania, and for quality measures, you have 8 homes out of 22 that have a 1-star rating. Then you have 4 that have a 2-star rating, 4 that have a 3-star rating, 3 that have a 4-star rating, and 3 have a 5-star rating. So as you can see, we're,
Well, now
I don't want to say we're in good company, but we're in company.
Put that in perspective with the amount of residents in each of those county homes. So we're the second largest?
Yeah.
The second largest county
I
home.
think they average 100 people in a home. Only 100. We have 6.
120.
Yeah, 120. Yeah, I knew it was
Yeah.
somewhere small.
Yeah, so
Right,
just
you
keep
can-
everything, it's a ratio. It's-
And if there's no other questions, the next, oh, I'm sorry.
Yeah, Brandon, I don't want to overstate this, and this is my opinion, that we had that one suicide attempt, the G, which gives us a lot of points.
Right.
If we didn't have that, and it's going to take us a while for those points to age off, but we did have it. But if we didn't have it, we would probably be a 3, right?
Yeah, I mean, we definitely would be closer to a 3,
Yeah.
absolutely, because it was 36 points as opposed to 4 points,
Right.
for 1D.
Yeah.
So it definitely does take, it's a chunk.
That's
Yeah.
a hit. I mean,
Yeah.
I'm not making excuses for it or whatever, but that's a hit. And
Right.
if we didn't have that, then it would be a little bit different. And I know it's,
They give
What
us,
it could've.
they give us points, like we get points on our driving license?
Yeah, but
And they wear off after so many
The points could be a
years of
lot
not-
higher, though.
Right, yeah, I understand.
A G is 36 points. I mean, I think we have
36.
36 points.
So
on
it
our
rolls off in what, 2 years? We're already a year into
license. 2
it,
to
right?
3 years.
2 to 3
We're already a
years.
year into it, 2 years?
1 year.
it was September.
1 year.
Yeah.
September's a year.
September will be done?
We have demerits.
Yeah.
Year to be a year.
It's going to take at least 2 years.
We have 72 points.
Yeah, it's a huge chunk.
It's ARD.
But you nailed it. I didn't catch that, and I said, Ray,
didn't
explain
get it.
this to me, how that continually affects us. And
Yeah.
he said, just imagine if you get points on your driver's license.
Right.
The same thing that you said.
Yeah.
That's how he explained it to me, which is,
Yes.
then when he said that, I said, okay, it's going to take us time for that, because I kept on saying, when's it coming off? When's it coming off? And then he said, it ages off, just like your driver's license. I'm like, I got
Is
it.
there a way to accelerate it off?
No. You can try to do things to increase your star rating, such as get your QMs up or your staffing. That will
Right.
bump you back up. But again, it still takes time. And then they report it quarterly, so you would still have to wait for that quarterly report, even if you were able to
By the
do
time
that.
by the time you did all those things, you'd be back up to
Yeah,
where
we'd
you
be
should
back to where, okay, next,
Sure.
moving on.
This will actually tell you the actual homes that are involved in the bar graph, and you see Graysdale is here as well. So you can see each home and what their quality
Right.
measures are. So it's just a continuation.
We're on the
Then,
far left column.
yeah. Then if there's no other questions, the very last article, Leading Age is an advocacy as well as a lobbying group for all nursing homes across the country. And this article is very interesting because they asked for a meeting with the Centers for Medicare and Medicaid Services to talk about could they decrease the number of immediate jeopardies that they're seeing from CMS in nursing homes. And as we know, immediate jeopardies means close to admissions.
Right.
So it's that bad that they had to meet with CMS, and they said they would take it under consideration. But just to let you know that it's much worse out there than here, actually, when you look at us as compared to other nursing homes and what they're going through.
Yeah, nothing like a bureaucrat that's looking for a job to do. Make things very difficult for everybody.
And I just had 3 real good things that I wanted to report. I wanted to let you guys know that our RN recruitment, we had a recruitment fair yesterday. We had about 14 RNs came out to go ahead and seek employment, plus we had another 10 who couldn't make the actual job fair but are set up for interviews for about a total of 24. So that's really good. That's going to help our RN pool tremendously if we're able to hire them, and several of them are definitely good candidates so far. They still have to go through all of them.
I've noticed that last year, at the beginning of the year, we had like 15% people quit and left, and this year we have 1% and things like that.
Yeah.
Did we raise the pay? What did we do?
Well, it's
What?
settled, yeah.
We settled the contract. So, what, 15 left as soon as you settled the contract, and now we're all back to normal? Yeah.
Retirement, that type of
So that kind of got stability in the workforce, so your retention. I mean, I'm sure you get pegged on retention rates, too, for a nursing home for,
Oh, yeah.
longevity of employees and all, too.
Not on our star rating, it's just the number of RN staff we have.
Right,
But
your
in
turnover.
general and internal reports, yeah, we do look
Right.
at that.
But
And,
that's good that that's so low
Yeah.
now.
Now.
Other thing, I'm sorry, go ahead. Oh, I was going to say the other thing I want to talk about is that I've started a Graysdale historical project. I really feel that Graysdale has a lot of history, and what we're doing is delving back into its inception all the way up until now. It's going to be called Graysdale Through the Years. So if anybody has any donations or know where I can get some donations, we would like to display it in the cafe area, which has a lot of display cases, and then make it a permanent display.
So you're going all the way
for
back to when the Moravians started it, or when the Lenape started a tent there and put people there? I mean, how far back are you going?
1778.
1778. It's a
All the way
long
back.
time.
Way
Yeah.
back.
The poorhouse.
Peabody machine.
And back then, it was in the middle of nowhere.
It was, that's
I mean, you had to
exactly
take
where it
a-
was, in the middle of nowhere.
Yeah.
But
Wow.
it took everybody.
Took
It was a
everyone.
way station.
Yeah.
They didn't even
And I
make
think
Martin
that-
guitars back then. back
No, they
there.
didn't. No.
Can I make a suggestion? If you're going to do that, you might want to reach out to the Historical and Genealogical Society.
We
Yeah, it might
actually
be
have.
nice.
Okay.
Yeah, since we donated a lot
And our
of money to
archives,
them.
too. Archives
Yeah,
probably has a
archives, too.
lot of records, the building we built.
Is it in that book?
Yeah,
Yeah, they probably go back all the way, too.
yeah.
Yeah, that'd be kind of, I'd like to see all that. That'd be
It's going to be
interesting.
really great when it's done, because there's so much really to offer about the history of Graysdale.
Yeah, but
You
because
want to have
people
something to
don't
say?
know.
Well, I just,
Uh-oh.
it's all good, Mr. Warner.
Mr.
Just to
Warner says
piggyback what you
all.
said, my dad was in St. Luke's, the Fountain Hill campus, and as you come in through the parking garage, they have the old pictures up, the old ambulances where the buildings first, and that's, you know,
And the old nurses. yeah,
I
the
I
old
love
nursing
history, so it's
school.
neat going in there and seeing the
Nursing
old
school there
pictures and, you know, the doctors in surgery, and, you know, I don't see how we made it out of the dark ages.
With the
but-
bottles of ether.
Yeah.
Yeah, it's crazy
It's
stuff.
really great to know some of these things, and I'm excited about it, and I think everybody else is as well. One last thing I wanted to tell you, on a very good note, we did get the VA contract.
Oh,
So we'll have it for the
fantastic.
next 5 years.
Good,
Cool,
perfect.
that's important.
Yes.
We got to know that.
I want to save that for last.
Okay, before you go, Seth, do you have any questions? Is he there?
No, I'm good. Thank you.
All right, moving on. Thank you.
Thank you very much.
Update on the Health Choices Division. Health Choices.
There are many.
Good evening, ladies and gentlemen. My name is Deborah Nunes, and I am the administrator for Health Choices. I'm sorry I didn't prepare a nice book like Gaysdale did, but we are getting our stuff together for the legislative breakfast, which is June 8th. So if you come then, you'll get it. If not, I'm sure you'll get it anyway, because we give it to everybody. I didn't know really where to start. Some of you know what Health Choices are, some of you may not. So let me just give you a brief overview. It started in 2001. It's actually the state's mandatory managed care. So we have to oversee the behavioral health managed care organization that is providing all the services for all the behavioral stuff. UMSOS oversees us and the rules, the regulations, the compliance. And then we make sure that Magellan has the contracts with the providers, that we have the services that we need, that if there's any unmet needs, we try to get services brought up here and put in. I can get into that a little bit later with reinvestment programs. We make sure that their network is good, their compliance with everything, grievances and hearings we have. So it's a pretty complicated oversight. And I have 4 people to do that with in my unit. One is a fiscal person who does all our budgets, all our different rates that we get from the state, putting them in, all the reports to the state that go on monthly, quarterly, et cetera, and then with the auditors. I have an IT person that does all the data, the claims, millions of claims. He's got 2 computers running at the same time. This guy's a genius. But he tracks everything from trending as far as if we're getting into an area where we're paying a lot of money for certain services and why. If there's some providers that seem to have been doing good consistently and all of a sudden they only have 3 or 4 members, what's happening there. So he looks into all of that. And then I have a young lady that does all the quality management stuff. She will go and do the audits. She will prepare for the hearings that we have for the members that have complaints about whether they're satisfied with the services they're getting or they're not satisfied or they want to have more information brought together. So we actually hold the hearings here. And then I have a clerical person who I'm happy to announce. I just awarded the position today. I'm waiting for her to give me a start date, and then I will have a complete unit again, first time since last year. So I don't know if that covers a lot of stuff, or if you have any questions about that part. We're supposed to make sure under Health Choices that we improve the quality of the services that we have, improve access to the services that we have, and cost containment to make sure that it's being done at a very sustainable rate, a cost containment rate. It's not very expensive. We had the medical assistance expansion last year, which means that we've got more members than we've ever had. We used to be around 34,000. We have about 49,000 now. So our membership has increased. Most of the new members that are coming in are primarily using the drug and alcohol stuff, which is good and which is not good because it's driving up some of the costs that we have to keep our eyes on. One of them is the detox and rehab for the heroin overdoses. They shot up last year. We are still looking at them. We're trying to get more beds for them so that they can be taken care of immediately, because there's wait lists before of about 25 people a week waiting to get in. And when you're at that point, when you're having an overdose and you need stuff immediately, you didn't want to wait. You want to get them in as soon as you can. Our three top costs are the inpatient for adults, the outpatient services for adults, and the behavioral health rehabilitation service, better known as BHRS, for children, which puts in all the therapeutic staff supports, the mobile therapists for the kids that are having issues in schools, issues at home, trying to work with the parents to transfer the skills, find better ways to deal with the kids. That's also under the auspices now of autism coming in as well. So now we have to have certified people under the autism to work with these people to make sure that everything is good and that they don't get out of hand and end up in hospitals and end up in group homes where they may not belong. Are you with me so far? Yeah? Okay.
Yeah, I have a little question for you.
Go ahead.
49,000 people, members,
Right.
using this. That's just about a quarter of our population for the county.
Yes.
How the hell is that sustainable?
Well, not all of them uses services. We might get $1 a head for everybody that is enrolled and eligible in Medicaid.
Mm-hmm.
And then if they're using services like our behavioral health, et cetera, then yes, it's costing us. If they don't use any services, they just became medical eligible, maybe they're taking care of most of their stuff under MA with physical health. We're still getting paid for that person, but they're not using our services, so a chunk doesn't come out.
Right.
But now the ones that are using the drug and alcohol and stuff are starting to be a cost trend for us, and now we have to figure out a way to contain it, improve it, help it. One of the biggest speed bumps we've had is trying to bring some new services into the communities and hitting problems with zoning and hitting problems with the community. They don't want anything in their backyard.
Yeah, everybody's
which
in
make
NIMBY.
things tough, yes.
Yeah.
But we persevere. We'll try to hit them in 3 different ways and try to get some things. One of them was we refer to it as the Northwestern's Extended Acute Care, which found a home 2 years ago at the Hartman's Ice Cream Place. And we use that very well, and it's always full. They can only serve about 12 people a year because they're allowed to be there for 6 months at a time if they need it. But at the same time, they're supposed to be stabilized, and they're supposed to be a diversion from the state hospitals, which is good because the state hospitals are closing. So we lost Allentown in 2010. Norristown's the next one that's closing. And as they keep doing it, and I wouldn't be surprised if you'll start hearing this stuff on the ID side now, because they're going through a whole lot of transformation. They're closing Hamburg, et cetera. And even though ID might get a little bit more money to help put these people in the community, again, they're going to hit not my backyard, and they don't know what to anticipate to put those things in there and get these programs developed. So they might be working with us. So that's basically my update. We keep plugging along. We still have some of the issues that we're working against, really, is the psychiatrist issue, that there's a shortage across the state. We have some, but they're going to retire at some point in time, and there's nobody coming out of the colleges that want to be a psychiatrist when they grow up.
Should have told my kid to be a psychiatrist.
So,
Darn.
so I
Yeah.
think what the state has to start considering, and I do think that they're doing it now, is the fact of having other people being able to, in the medical field, being able to help out, whether nurse practitioner, a licensed social worker can maybe do an assessment on the spot, et cetera, because if we all wait for the psychiatrist who's credentialed to do that, it might not get done. We still have a long wait list for people to get in to get their medications and to be able to see a psychiatrist because they're so far and few between.
And you do all this with 4 people?
We oversee the whole thing with 4 people.
4 people.
Yeah.
And me. I'm just the figure.
5.
Debbie, I'm just curious.
Sure.
Okay?
Go ahead, Mr.
I'm just curious, how many people certified do you have for the autism programs? I mean,
I don't have the number, but I know a lot of our providers, they have to be certified to work with the autistic
but I
kids.
mean, are we getting more children into the programs because of that?
Yes.
And how
I'm
much has
waiting-
that increased
We
since?
haven't gotten that stat yet because it
Okay.
started, the recertification and
Yeah.
it started the beginning of this year. So probably by the end of June, I'll have an oversight for that.
Okay.
get the numbers in. But the autism is increasing. That's one of the issues that we've had with the kids services, because they get very aggressive, they're acting out. A lot of them are in our residential treatment facilities. Some of them can handle them, some of them can't. They go into a hospital. They stay in the hospital because there's no place to discharge them, because the way that system is, if the person's aggressive, whatever, those providers can say, nah, we're not taking them. We'll take somebody else that we can work with. Now that we have the certification, we can do stuff in the community.
They mainstream some of these kids that are autistic into the homes and the schools, and then they become disruptive, and then they don't have an answer. And they're not taken care of properly. And I know I've heard that from many people, so I just was curious how you...
Well, and it gets even better when they're adults. Because once you're not a kid anymore and you're an adult, the adult services have to help you, like Asperger's, which is dimensional autism. There's not as much for you on an adult level as there was for you when you were a kid. So we're trying to work on that too.
Well, if there's not any more questions, like, thank you for all you do in your department. I mean, it sounds like you're slammed with work.
No 2 days are ever the same, so it kind of exciting.
But you're still smiling.
Yeah.
So,
Takes a special person.
Yeah, I know. Well, thank you for everything you guys do. And I don't know, Seth, do you have any questions?
No, I'm good. Thank you.
Okay.
All right. Thank you very much.
Thank you so much.
Take care.
Thanks, Doug.
Next thing on our agenda is update on the Department of Human Services.
You make noise coming up.
Good afternoon. Yes, I'm making noise. Good
Are you
afternoon.
clicking?
You got a magnet over there? You're kind of funny.
Yes, I have metal in my leg.
I know.
Yes. Let me go back to Graysdale real quick. On Sunday, Graysdale is having its annual volunteer recognition event. So that's at 2 o'clock, and that's in the main dining room, which is different. Used to be in the chapel, so that's this Sunday. Also, I know I've said this before, but I'm going to say it again. The Area Agency on Aging Advisory Council is sponsoring their Outstanding Senior Volunteer Recognition event, and that will be Thursday, April 27. That's at 1 o'clock. Thursday, April 27, 1 o'clock, and that's at Wesley United Methodist Church. That's the one on Center Street. So,
Okay.
wanted to make you aware of that.
You go to Bethel? You go to church?
You going?
That's my
You going?
Also, just to close the loop, I know that you folks have been made aware of the crisis intervention training, which is a training for first responder police officers, law enforcement, so that they are made aware of tips, techniques to deal with an individual who is in a mental health crisis. The idea being, first and foremost, the officer's training, then, of course, their policies, and then information around individuals in crisis who have a mental health issue, so that, one, the individual experiencing the mental health issue is safe, and the officer is safe. So, Northampton County sponsored a training. We had a lot of support and a lot of people attend, local law enforcement. We had some folks from Bethlehem Township, Colonial Regional, Palmer, Lower Saucon, some sheriffs, some state parole folks. Training went wonderful. It was well received. And a week later, in the Human Services building, we had an individual, a client, who was going through a mental health crisis. Emergency services were called. And would you believe one of the officers who just went through the training was called to respond, and all went fine. Our citizen was fine. The police officer was fine. It was a perfect example of how that kind of training works out. So I wanted to bring that to you as a positive thing that has actually worked. Another positive is last night, the drug and alcohol program for Northampton County with the AVA volleyball program sponsored a drug and alcohol awareness event last night at Nazareth High School. About 200 people attended. On deck was Larry Holmes, and he provided some words of inspiration and how he could have gone down the negative drug path but did not. Also, talking was a graduate of Nazareth High School. She talked about her recovery, so that was a positive message. And then the main speaker was Alvin Powell, who was offensive lineman, Miami Dolphins, Seattle Seahawks, and he spoke of his road on the influence of drugs and how he has rebounded, and everyone heard his message of hope and resilience. So that was another positive thing. So, other than that, Human Services is still moving along. The building, the Human Services building, is just fine. Absolutely. What other questions?
Staffing levels, are they all up? You have everybody you need?
Staffing, we are constantly
Right, it's,
going through. Right now, we're at 11% rate of what's the word, Allison?
Turnover?
We're down 11%.
you're down 11% of the people you need.
Thank you. Yep.
Okay.
And that was as of today. It could change a minute from now when someone's hired.
Okay.
Yeah, but we're running
And the
at
hiring
11%.
system has gotten easier? Because I know we had problems with, people getting online and doing it.
Yes, I would say we're constantly improving it,
Right.
with HR, with NeoGov, with civil service, we're always constantly.
But you still have, they have to take a civil service exam, they have to do this, they have to do that, they have, the whole thing to get
Yep.
in, so.
Yep,
it's
but still, we're trying to make it as
bureaucrats
efficient as
again.
possible.
Hayden.
Yep, things online, we're doing what we can, always moving.
Does anybody have a question for Allison? Seeing none, thank you.
Thank you, Allison.
All right, it's a motion to adjourn. Got it.
Okay, more coffee.
Thanks, Ken.
Bye, Seth.
We're going to be here in 20 minutes.
Seth. Craig,
Yes.
don't forget your book.
Yes.
Are you gonna